We are right at 3 o'clock, so we are going to go ahead and get started. I am Megan Lippe. I'm an associate professor at UT Health in San Antonio. I'm also an ELNEC faculty member, specifically one of the 2 faculty who help support schools of nursing with their palliative care education. My colleague, Dr. Andrew Davis, is not able to join today, but she's sort of my other half with this. Today, we're going to be focusing on symptom management, specifically ELNEC Undergraduate, New Graduate Module 4, which focuses on symptom management in undergraduate education. We are very fortunate today to be joined by Pat Coyne and Connie Dahlin, who are experts in symptom management. So about partway through our time together, we'll open the floor to them for y'all to ask questions of them related to teaching symptom management with your undergraduate students. So just know if you have any burning questions related to palliative care education and symptom management and the undergraduate realm, have those questions primed and ready. As we get started, I just want to do real quick, just a little overview of our ELNEC initiatives. I see lots of familiar names. Some of y'all have joined us before. For others, y'all, this might be your first webinar. So just want to make sure y'all have a little bit of the history here. When we think about the palliative care, a lot of, when we think about some guiding documents, one of the ones that we refer to quite a bit is this joint statement between ANA and HPNA. That was a call for action for nurses to lead and transform palliative care. And one of the big tenets of this call, there were many items that came forward, but one of the ones is that the #1 recommendation was that nurses and schools adopt the ELNEC curricula as a way to educate nurses about palliative care. And at that time, ELNEC had recently launched the undergraduate curriculum and has subsequently also launched a graduate one, but specifically citing that undergraduate nursing curriculum is sort of the gold standard for teaching palliative care didactic content. And so that's the focus of what we're doing with these webinar series, is working through what are in these modules. Oops. Also, just a little bit of the history of ELNEC. So the ELNEC project started in 2000, and this was when a team of leaders initiated ELNEC Core, which was the first curricula. The first course was delivered in 2001, and then subsequently there have been many different types of courses that have been developed and implemented across the country and internationally, with some of the most recent ones being ELNEC Undergraduate. It was ultimately renamed to ELNEC Undergraduate/New Graduate because we recognize the undergraduate, new graduate curriculum is really targeting those entry-level nurses, more those novice nurses. So we do see some residency programs using the curriculum as well. And then ELNEC Graduate came online in 2019. Those are the other webinars that we offer. We kind of alternate between ELNEC Undergraduate and Graduate. Many faculty, I think, have now seen the essentials. You've heard of the essentials, but the essentials came out in 2021. They have level 1 and level 2 competencies. Again, ELNEC Undergraduate, New Graduate is going to align with delivering didactic content for your level 1 entry nurse. So a lot of that foundational palliative care content that they need. The exciting thing for us in the realm of palliative care was the naming of hospice palliative supportive care as one of the 4 spheres of care for which nursing schools need to train and prepare their students for practice. This has been, we feel like, a game changer in many respects because it sort of transitioned palliative care from a nice to know to a need to know for our students. But on the tail of that, it's okay, well, how do we teach this to our students then? It's of all the spheres, it's the one we hear is the one that maybe is the least already embedded in nursing curricula. And so part of our goal with these webinar series is to help faculty think about how can they teach and address this sphere within their current curricula. The other thing we want to share with all faculty to make sure you know is this resource is that we have CARES and GCARES. These are competencies and statements for undergraduate and graduate students, specifically within the realm of palliative care. CARES is the sort of global competency statements that we would expect all entry-level nurses to be able to attain by the end of their undergraduate program. So those of y'all teaching in undergraduate programs, we really recommend you look at CARES. Those were recently revised in 2022 to align with the new essentials. And then we even have additional resources that align with the subcompetencies and domains and all of those things. But there's statements that specifically inform undergraduate curricula related to palliative care. And when we think about symptom management specifically, there are quite a few of our care statements that align with symptom management. One of the ones thinking about the complex and evolving socioeconomic factors. So when we think about symptom management, thinking about that holistic approach to care, meeting the patients where they are, this idea of culturally sensitive, quality palliative care. How do we address that from a symptom management approach? Making sure there's this interprofessional coordination of care for our patients. We talk about that in our module. Making sure we're aligning the plan of care with patient and family values, beliefs, preferences, and goals of care. And then more specifically, many of the care statements align with sort of the nursing process. And as you'll see in just a moment, we actually organized our symptom management to also mirror a lot of nursing process. So we start with thinking about how do we approach the assessment of different symptoms. We talk about how we might develop our plan of care. What are those evidence-based interventions we would want our students to perform, both pharmacologically or non-pharmacologically, and very holistically for the patients. There's a competency statement about ongoing reassessment and evaluation to make sure that the interventions are working to achieve good symptom relief and improve quality of life for patients. And then also we do recognize that patients at end of life have different symptoms and symptom management needs. And so thinking about how we might tailor plans of care to those patients who are in the dying process. So again, please reference the CARES competency statements. We know a lot of schools are using those as even some course objectives, programmatic objectives as a way to guide their teaching in the sphere of palliative care. And then also just briefly want to mention my colleague Andrew Davis and I have developed a competence assessment tool. This is still a fairly new resource for faculty. This actually maps out some behavioral objectives that align with competence. So things that you as an educator might be able to observe students do that would support that they are implementing quality palliative care. And again, we have with regard to symptom management, we also have a lot of competence statements there. But we're not, that's not the purpose today to go through this. Just want to make people aware that resource is also available to faculty. As we think about webinars, we have to date covered modules 1 through 3 of the undergraduate curricula. Today we're focusing on 4. We'll be finishing up 5 and 6 later this year and the beginning of the next year. All of these webinars are recorded and they're available on the ELNEC Faculty Corner. So please know if you missed any of these and you want to find out more, the recordings are available. All right. So to date, as of our last stats, ELNEC undergraduate, new graduate is being used in over 1,000 nursing schools across the country who have accessed this, and graduate growing as well. It's in almost 400 schools of nursing. So we're seeing a great utilization across the country. And my colleague, Andrew and I, we're here to support schools who are in whatever phase of integration of ELNEC undergraduate if they're wanting to use that in their program. All right, so now what you really came for, the symptom management. One of the things that we want to share, we're very excited about this, is that effective September of this year, so this month, ELNEC undergraduate has a new edition. So it has been updated, it has been revised. We have made sure it aligns with the new essentials. We've made sure it's reflecting current practice. It also, we were very intentional about responding to learner feedback from the prior edition and updating the modules accordingly. So I want to show y'all this, but I want to just share the way that this rollout is happening, because I think that's a question people might have. If students purchase ELNEC Undergraduate now, moving forward, they will have full access to all 6 new modules. If your student had previously purchased the curriculum and they're still in their 12-month subscription period, their 12-month access, any of the modules they've completed will stay as the old version, and any module they have not yet accessed, they will have access to the new version. So they kind of get a mix for this next year, but any new purchase will be the full new curriculum. And if at any point any school has any issues with that, please reach out to us at ELNEC so we can help support you. We haven't heard of any issues to date, but that doesn't mean they may not be out there. So if at any point your students have any technical issues, we're happy to help facilitate your connections to Relias for that. All right, so with that, one of the things we want to do is just show you what's in the module, but also the new platform, because not only did the content change, but the layout has changed as well. So let me real quick pull it up. So can y'all see this okay? All right, so symptom management, you'll see there's, again, it's a whole new look. So when you go to this first page, it does provide students with an overview of what all of the topics are. Symptom management is probably one of our longest modules of all of them because we want to be really comprehensive. So as you can see with the quick scroll, we do a lot of physical symptom management, psychosocial and spiritual management as well. And so the students are taken to this homepage. When they enter the course, they do have a little overview about this module. We have our learning objectives listed here as well. This is sort of the way all of the beginning of the modules look. Some features: students are not able to progress to the next part of the module until they've completed all parts of the page that they're on. And so I've opened everything up because we don't have time to go through the full module. But what I wanted to show is just some exciting features we have in all of our ELNEC undergraduate modules. In the new platform, we have some different interactive features. So students can open up some content when we really want them to be intentionally thinking about acronyms or helpful resources for that. As we've seen in many prior modules, we have videos from our experts. This is Dr. Judy Pace speaking about symptom management in older adults. In this new platform, students do have to watch the full video before they are able to progress to the next content. They are not able to click forward to the end of the video. It is locked, so they do have to listen through the video. Now, there is a way to speed it up, kind of like YouTube. They can speed up a little bit faster, but they do have to listen to the full video. And then again, we go through lots of our symptoms. They're all structured the same way. So we lead with a little bit of an overview of it. So I'm going to just show constipation because it's got some of the really fun features here. When you start the section, we do an overview of what this is. We go over the different causes. As you can see here, we've divided it into physical, psychological, and treatment-related causes. Then we go sort of nursing process approach. So we think through the subjective and the objective assessment of whatever symptom that might be. In our constipation and in other places too, you'll see there's some interactive flashcards. So students can click on this and it's a way for them to, again, engage with the content. And then we go into the management of this. So pharmacological, non-pharmacological. The first time students are accessing it, they would need to click on all these and read through the pieces of it. And then also throughout the modules, we also have practice critical thinking questions. They are NCLEX style-ish or they're case study based. Students do have to answer the question correctly before they are able to progress. So as you can see here, the students have a question. I'm having to take it again, but the first time it would actually open up to this, they read a case scenario and they answer it. If the student answers incorrectly, they'll get a little bit of feedback on that, but they will have to take it again. So you see here it says 0. They have to take it again. When they get it correctly, it'll give them feedback and then give them the 100%, and it opens it up for them to progress. Mine looks like you could go forward for both, but you can't. Your first time through, it does have to be answered correctly. And then there's lots of other interactive features to this, but we just wanted to make y'all aware it does look different. And one of the things we tried to be intentional about is reducing the number of clicks. That was a consistent piece of feedback, is that there might have been a little bit too many clicks, and so they are reduced, but there still is enough interactive requirement that students can't just breeze through it without actually reading what's there. Do y'all have any questions about the new format before we go back to our featured program here? Y'all are welcome to drop questions in the chat, or you're welcome to ask as well.
Megan, this is Loris, and I just have to sit here and smile. Where was all of this when I went through college, right? And in fact, I went back to my alma mater, and just for the fun of it, I walked up to these cute little gals, behind the desk, and I said, "I'm here to check out a film strip and a tape recorder." And they said, "What?" I mean, do you guys remember that? I mean, I'm really dating myself, but film strips and tape recorders, and look at this. It's just our new graduates don't know how good they have it.
Yes. Exactly. And one of the things, thank you, we encourage a lot of faculty to use these modules in a way that best meets their curricular needs. So for some schools, so I'm based in Texas. Texas has really stringent criteria about how much class time can be online. We use these modules as a prep. So instead of textbooks, which we know historically are very outdated or very minimally covering palliative care, for my students, assign the modules as a pre-class activity. When the students finish the modules, there is a knowledge assessment. There is a test that they take at the end. Once they get an 80%, they get a certificate of completion for that specific module, and they can upload that certificate into whatever your learning management system might be as evidence that they completed the module. One little caveat is just know they can't, once they earn 80%, they're good. They can't go back in and take it again to try to get the 100. So we recommend people give credit for completion and not the score that they earn on that test, because they don't have control over retaking it to get 100 if they've passed it. But some schools use it again as prep work. Some schools use it in different ways. They use it as a class activity or whatever makes the most sense for you. We're not prescriptive. We just provide resources. So with that, I'm going to turn the floor over to, again, our symptom management experts, Coyne and Connie Dahlin. I'm going to let them introduce themselves. And then this is really a Q&A session. We'll spend about 20 minutes or so, 10, 15, 20 minutes just for y'all to pick their brains on how to teach symptom management in your undergraduate. And because we're more of a dialogue now, I'm going to stop screen sharing just temporarily. I can figure out how to do that with my Zoom. Okay. Hey, where are you? All right, who has questions while I try to figure out how to stop my sharing? Here we go. Or actually, Pat, do you want to introduce yourself?
Sure. I see actually some familiar faces out there. I'm Pat Coyne. I'm actually just quote unquote retired as the director of palliative care at the Medical University of South Carolina, although you wouldn't know it because I'm working as much now as when I retired, and been doing palliative care since before it was palliative care, and one of the original ELNEC co-investigators. So how's that?
Fantastic. And Connie, do you want to introduce yourself?
Hi, everyone. Connie Dahlin. I've been a hospice and palliative care clinician all my life, and I currently practice. I also teach at the University of Maryland Graduate Palliative Care Program, and Patrick and I have an externship. So I keep busy, and we created, Patrick and I, it's been 10 years since we created APR and ELNEC. So lots has happened in the last 10 years.
And if you are interested in more, they did write the actual textbook. Oh, y'all can't see it. Woo. They wrote the textbooks of APR and palliative care and the little clinical pocket guide. So these are the gurus of symptom management and palliative care for APRN. So we're so excited to have them.
I mean, I think the first thing that I would just say about teaching younger students, because I have younger students in my family, is the symptoms part of the things that they know is just sort of interesting because it's more comforting to them than the communication part, because talking to people scares them. So getting into symptom management is actually an area that people feel like they can talk about it. There's some tasks that we can really be teaching about assessment. And so I also think that, these are the types of things when you think about your practice and, you being on the floor, what were the things that you were scared about? The scary part was like a patient would have a symptom and you wouldn't know what to do with it, right? I worked on surgical oncology when I first started. And so I can just remember patients were in pain, patients were vomiting like crazy, patients were constipated. So really thinking about, this module is really about what the students may be most comfortable with because it's so concrete. But having said that, it's a lot of a module. And as Megan said, there are so many different symptoms. And I'm sure Patrick is going to say this too, but, really trying to figure out where your students are practicing and start with the most common symptoms, because there's so many that they will get overwhelmed. So really trying to think about what are the things that are worrying them that they feel like they need to have the knowledge. And it might be different if they're in acute care versus they're in a long-term care setting, or geriatric patients or, younger adults or things like that. So that, having a sense of what is their primary concern is helpful. Patrick, I don't know if you have other ideas.
I mean, I think the biggest thing is it is a huge module and there's a lot there. And I find that when I'm teaching it, I tend to just break it out into like GI symptoms and focus on them, or respiratory. Dyspnea in and of itself could be an hour or two talk. But so just trying not to overwhelm them, trying to do multiple symptoms, I think can be a challenge, and you can incorporate these in so many places. The nausea can be part of really post-op pain management, and how would you do it differently with A, B, and C? And so I think there's a lot of ways to look at incorporating the things they need to know, because a lot of these transcend even palliative care as we look at it, like dyspnea is a good example.
The nice thing with symptom management too is that you can really think about scaffolding this across your curriculum, where in the beginning you really could think about really looking at one symptom more in depth, or sort of unpacking how would you care for that. And then as you get to students who are later on in the curriculum, maybe your senior students or those about to graduate, thinking about how would you manage a patient who has multiple comorbidities and has a lot of symptom burden from multiple symptoms, and give them some opportunities to critically think and use their clinical judgment from that. I wouldn't give that to a first semester student, but maybe those closer to practice, that's the reality, is that they will see patients often who are experiencing multiple symptoms. So how can they use, again, what they've learned in this module, but apply it in different ways throughout the program? There is a question in the chat on how long this module is. Again, this is the one that we probably added the most content to from the original version based on feedback. We've added quite a few symptoms and even expanded more on what was there. So according to the calculations that we did with Relias, it's about a 2-hour module now. So it is quite a bit longer, but it was, again, recognizing there was a need to incorporate some more symptoms and then also really kind of walk students through the nursing process for each of those.
And I would say, actually, though, Megan, I mean, that's like what they said by the numbers for CE, but there's so much content. And if you're really wanting them to take the time to focus on it and not fly through, you know, that's a whole different piece to it, right? And because I think some of the examples, and I think the other part is thinking about where your students are, right? Because some of them have started during COVID and might have a propensity to think, as Patrick said, a lot about the respiratory symptoms, but helping them understand that really sick people have a whole sense of different symptoms. And I'm seeing on my floor, just yesterday, the newest group of nursing students came up, and they're from a local college, and they were all in their blue, and they were so bright-eyed. And I'm thinking, wow, they are coming in at an interesting time for the staff, and hearing them talk about some of the symptoms of the different floors, and, you know, knowing, you know, what their investment is if they're on a cardiac floor, what they're going to be thinking about versus on the general medical floor. Or, yeah, I work in a safety net hospital. So for people to be sick in the ICU, you know, what does that look like? And it's usually delirium and confusion and things like that. So really trying to think about where the students are when they're starting this, of how they are applying this to the patient population that they're currently doing clinical. And that's the other part, I think, for them. It's really hard to kind of think about teaching this if the students don't have patients in front of them, right? Because there's so many concepts, and helping them really kind of identify a patient with them and telling you their stories afterward when you're kind of reviewing the material, I think is really important.
And I think what Megan brought up is that there's always going to be symptom clusters. And so you're not going to have a patient with typically a symptom, you know, so they're constipated, now they have nausea and vomiting, now they're short of breath because their diaphragm's pushed up, now they're anxious. I mean, there are ways to incorporate in a case study a lot of different symptoms, and because you can't silo these because they're all interconnected. And I think that when you're teaching this, I find case studies work the best, is, you know, because you're not going to find just, oh, we're going to treat nausea. Well, there's more going on to it than that usually. And so I think that's kind of the fun of it, is, you know, kind of everybody wants one answer. And, you know, palliative care, we never have one answer. There's always a lot of things going on.
You know, in an undergraduate realm, a lot of schools use simulation as a primary learning, you know, teaching tool. And so thinking about, you know, one of the things we encourage schools to think about is that, you know, palliative care exists anywhere there's patients living with serious illness, right? And so we would imagine a lot of schools already have acute care or critical care or a whole host of simulations, and thinking about how you could use those as a way to really immerse students in a scenario of having to manage symptoms. Maybe you have a patient who has 2 symptoms, and the students are really having to think through how do they prioritize the orders to manage that symptom distress for patients, or what's missing, right? What do they need to be advocating for to care for that patient and provide symptom relief. So there's lots of opportunities to either create simulations or modify simulations to think about how you can bring that palliative care lens into the case. Real quick, wanted to mention, you know, Connie had mentioned in the critical care setting, delirium, and one of the changes for this new edition is that we actually have a whole section now on cognitive changes, including delirium. So we've actually done a fair bit more with symptom management with delirium and other cognitive changes as the symptom patients might experience in serious illness. So I just want to put the plug in for that. Olga.
Yeah, thank you. And it's just so exciting, obviously, to see this, intensive symptom management content. So a question I have just came up at a recent CBE work group meeting at my university, and not related to palliative care, right? But of course, it's all intertwined. And anyway, so we seem to have this, I would call it a challenge, whereby even though each each section of a course has the same learning outcomes, right? Course learning outcomes. Because of how faculty interpret academic freedom, we have faculty using very different, or not very different, but let's just say different, right? Learning activities and assessments and such. So for instance, like the idea of scaffolding ELNEC undergrad throughout the course becomes a challenge because right now, there's no way of actually seeing that, like if we say, oh, we highly recommend that you use the nausea and vomiting in your, like, let's say post-op or whatever, wherever you're teaching that. So I'm curious, like, do any of you all work at universities who have a similar challenge? Or, I mean, I know some schools require the same assessments and learning activities across, across faculty teaching the same course. So suggestions or discussion about how to really, in a realistic way, deal with that. Thanks.
So we'll definitely let other people chime in too. Some things that come to mind that where schools are facing some challenges with, how do we have some consistency, but still let people teach this as they wish, right? Is really thinking about how, again, you can integrate the CARES competency statements into some of the course objectives or the module objectives, however that course is laid out, as a way to sort of do some accountability checking, right? That maybe they do different types of activities, but if the goal of that learning unit is for them to really address, a specific CARES statement or a few CARES statements, that might be one way to do it, right? Is that if we're all working toward the same student learning outcome for, and then how you backwards design, how do you get to competence with that? Yes, people might do different activities, but a lot of schools have shared with us that being able to link their course objectives or their program objectives or unit objectives with CARES, or even just use CARES as objectives, has been a really helpful strategy for reinforcing palliative care content in the curriculum, but also holding some accountability across faculty. But welcome the floor for others to share if they have strategies. That's okay if not. We do know there are some schools that actually use the modules as a post-conference topic where students will complete the module as part of their clinical course, and then the post-conference or the pre-conference time is spent working through that module through various types of activities. And we recognize that there's quite a bit of variability across faculty in those contexts. So again, I think CARES is a helpful way to do that. Let's see. Other questions related to teaching and symptom management? Y'all can drop it in the chat too.
I was just going to say, when you get to some of the psychosocial issues, those are the types of ones also when you're trying to discuss what they've learned online, is bringing in some of the psychosocial people. So they start thinking about, what does a social worker do? What does a chaplain do? Because I think a lot of them don't know those players. And so identifying quickly, who those people are is really important, particularly I have been distressed these days because we have some great social workers where I work, and on any given day, they're flipping back and forth between discharge planning and social work. And it's a sad for me because they are such skilled clinicians and we need them. But I think still having the students be exposed is really important.
Yeah, I would actually second that, is to learn where they're practicing the resources available. And every clinical site has different resources. Connie mentioned social workers, but it could be anything from play therapists in pediatrics to, we have music therapy. And I think a lot of people forget with music therapy, they're all licensed to counsel. So sometimes they never play music and it's all counseling. So it's kind of resources that are present that may help guide them and support them as they learn, nursing can't do it all, but know who the players are.
As we mentioned, one of the care statements is about that interprofessional collaboration and working within the team. And again, while any of the modules, are great opportunities for interprofessional collaboration, symptom management is a nice way to think about it. So if you have a respiratory therapy program, how might you design some interprofessional learning related around dyspnea, or thinking about who are those other individuals on campus, and how might you use symptom management as a way to do some interprofessional education, because that's a lot of times where we do see teams coming together. Of course, in other ways too, but across care settings, sometimes it seems to be, centered on maybe there's some symptoms, and that's when a team might come together, whether it's in the physical realm or the psychosocial, spiritual realm as well.
And I just think the other part is having confidence in yourself of kind of reviewing some of these symptoms, because I think for them to know that things have changed, treatments have changed. And so what they're learning now might be different in a few years, I think, as all of healthcare and with advances, but I think it's just really important to pay attention to that. I think also, gone are the days where we actually can treat everybody sort of ecumenically in settings, because you actually have to know what their insurance is before we're thinking about some of their treatments. So I would just strongly encourage about this whole conversation, a little bit about social determinants of health in these conversations about symptoms, because somebody doesn't live near a pharmacy, or they can't get access to certain things, but they also don't have money for some non-pharmacological things like heating pad, or some of the cooling things, or physical therapy or something. It's just really important to help people to think about that, because I think I've just seen so many patients recently that we've had discharged and on a treatment plan with medications that were not covered under their insurance, or we didn't pay attention to that and they couldn't get something, and then they get readmitted. So helping students start these patterns now, that really thinking about, it's not just treating it, it's really thinking about the whole patient of where they are, which is so important.
Yeah, and in that same vein too, we think social determinants of health, but also so much of a palliative care approach is grounded in patient preferences and goals of care. And so as students are working through the module, or they're thinking about symptom management, there's a lot of ways to manage symptoms. There's pharmacologic, non-pharmacologic, there's a mix of things, but also helping students think about, yes, there's all of these options that might be included, but what's best for the patient? What best aligns with what those patients' values and beliefs are? If there's religious or spiritual considerations, really challenging students. And again, knowing your level of learner. Is a beginner, a junior, new student able to think that far? Maybe, maybe not. But if you're thinking about how can you continue to develop their symptom management skills and clinical judgment across the curriculum, it's like, all right, well, yes, here's this whole list, but what is the best for the patient, and how do you elicit that information and then develop the plan accordingly? So the next thing I want to show y'all related to this realm of symptom management. Oh, Pat, did you have something?
I was just going to say, I think the other thing is a great opportunity, especially as new learners, is to understand appropriate tools for symptoms, like, ESAS or MSAS, and the importance of them, because I think everyone kind of thinks, I'll pick on dyspnea, respiratory rate's 18, nothing to worry about, and yet you don't know if you don't ask the questions. Or depression, and these are, like Connie had mentioned earlier, uncomfortable questions to ask someone if they're depressed or if they're having anxiety. But I think an ESAS or an MSAS kind of prompts the questions, and so understanding the importance of tools, especially in symptom management and palliative care, is, I think, critical. And so I can't say enough about that in the assessment part of it, because I just dealt with medical students this morning who, there was no dyspnea, quote unquote, because the respiratory rate was 19, this guy can't answer a sentence without stopping 3 times, so I think there's a great opportunity here just to make sure that you're letting the students know there are tools they should be thinking about these as normal practice.
The next thing I want to introduce everyone to, let's share my screen again. Sure, okay. Make sure I'm sharing the right thing. Are y'all seeing the ELNEC page here? So the ELNEC web page is housed within AACN, the American Association of Colleges of Nursing. We've had a long partnership ever since ELNEC's inception. But one of the things that we want faculty to know, we do have a faculty corner, and I'll share that towards the end of our time together. But there's this ELNEC resources page, and on this page, there are some really incredible resources. Specifically in the realm of symptom management, though, one of the things is there's pain and symptom reference cards. So I pulled it up, but there's this great, it's a 2-sided document. I recognize it's very small right now, but essentially it's a quick guide for symptom management. It's currently being updated, so this is the latest and greatest, but by the end of the year, there's gonna be the new version coming out. As you'll see, that's kind of a theme with a lot of the ELNEC resources, is we want to keep them up to date. But this goes through just some helpful, again, quick references for different symptoms. The other thing, I'm going to go back to this resource page, is there's infographics. These sort of emerged in the last few years as helpful resources when in the COVID pandemic, but there's infographics related to anxiety, dyspnea, pain, long haul COVID, and then non-pharmacologic management of stress. So if we were to open, for example, long haul COVID, it's just a 1-pager, but it talks about management of patients with long haul COVID and some of those symptoms that they might experience. This can be really helpful as if you're trying to think about new teaching strategies or ways to integrate symptom management into your courses. In addition to, this module we're talking about, there's also these great infographics and this symptom management card that you might consider using in some of your teaching strategies as well. Thinking about, again, focusing on the undergraduate learner and where they're at, this might be a source of inspiration for y'all with that. So in our last little bit here, what I want to do, so if y'all have attended our webinars before, y'all know we like to learn with and from one another. And so in our last little bit, we have offered 2 ideas for breakout rooms. You will get to select which one speaks most to you. If you're in a place where you're trying to envision how could you do this in your teaching, or you have sort of some general questions about symptom management teaching, you're welcome to join breakout room 1. This is a place to just share. If you have a teaching strategy you love that you think works really well, please share it in that room, but also share it with us. We do have our faculty corner where we like to post great teaching strategies. The other, if you're really wanting to explore those infographics a little bit more and think about how those might be used in your teaching, please join breakout room 2. And then if you're not sure, just pick one at random and continue to learn from this community of individuals. So we do make these slides available at the end of our session as well as the recording. So there is a slide here just as a helpful reference of what were we talking about with those infographics. And then the last little bit here, we do have, again, some resources. These are some of the documents that we referenced before. And the last thing I want to show our faculty, we end all of our sessions with this, is the ELNEC Faculty Corner. There's a QR code where if you wanted to scan this and take you to the corner, we provide the hyperlink, but I'm just going to go there directly here. So you can, from the ELNEC homepage, so again, you can just Google ELNEC or search ELNEC. And this very first part here is the Faculty Corner. If you go into this, and we are currently working with AACN, so this is going to have a new look in the coming months. All of our upcoming webinars are here. We have scheduled through the remainder of the year. So if you want to go ahead and sign up for the next ones, please feel free to do so. But one of the things that we have, again, you can see here the recorded webinars. All of the ones we have done, again, we started at the beginning of this year, all of our modules. We also have a whole host of webinars from before that you're welcome to see. Want to briefly mention too, we've started a regional support model where we've identified palliative care faculty champions. Olga's on our call, she's one of our champions. So if you're wanting to find someone who might be in your area, who can support your school, you're welcome to check out who your support person might be. If we don't have a chair, it's Andrew and I are your points of contact. Everyone has someone they can reach out to, but we have identified some other experts who can help. But I want to just show you towards the bottom is our teaching and evaluation resources. And so this is where we encourage faculty who are doing great, exciting things in the realm of teaching to share with us. We have some simulations that have been shared by different schools. We have some teaching exemplars, so some case studies. And then also Dr. Davis and I have developed many different instruments over the years to evaluate student learning outcomes. And this is just gone live this week where we have a link where if you want to access any of those, there's some questions you answer and you can get the PDFs to directly access our tools for your use in your learning. But this is where, again, we have even more resources for teaching for free. All of these are free. You go to the website, you can download them. And if you're doing anything exciting that you want to share, we have an opportunity for you to share. You can click on this call for submissions and share. Once it goes live on our website, put it on your CV. It's scholarship for teaching. This is a method of dissemination. So we encourage faculty who are doing great work in palliative care to share your strategy with us. And we can put it online, and it's, again, not only does it benefit schools throughout the country, their faculty could use that same idea, but it also is a little perk of it's a scholarship opportunity for y'all. So again, this is on the ELNEC faculty corner. Also, just a last little plug. We also have ELNEC courses. Many of us will be in Charleston next week for the summit. It has sold out, so can't join that one. But if you look in the near future, there's APRN oncology will be in January, and then we will have more courses every year. So there's more. This will be updated soon with our exciting next locations. But if you're wanting to learn more about palliative care, we highly encourage schools to attend a summit if that works for you.
This is Andre. Real quick, Charleston isn't sold out just yet, so there's a couple more spots. Geriatrics almost there. If you'd like to register or apply now, just go for online and register there.
Okay. All right. Well, thank y'all. We are at time. I want to just thank y'all for joining us today. We hope you'll join us again on a future webinar next month. We are looking at symptom management for the graduate side of things. Patrick and Connie will join us again as well as we put our different hats on and think graduate education, and we'll finish out the rest of the ELNEC modules later this year and the beginning of next year. So thank y'all. After this, you will get an email that has the slides and the recording. So please know all of these resources will be available to you. All right. Y'all have a great day. Thanks.
Thank you so much.
Thanks, Pat. Thanks, Connie.